collarbone fracture hospital. Our hospital is located opposite Tirupur Government Hospital, which is renowned as a technological hub in Tamil Nadu.
The sciatica nerve, which is the largest and most important nerve in the human body, connects the brain to the spine. Many people experience back pain from the spine. Occurs, they say they have problems with L4 and L5. L4, L5, S1, S2, S3. These 5 nerves combine to form the sciatica nerve. It forms the nerve known as. This process starts from the spine, which is the central support structure of the body, and extends all the way down to the legs, providing essential support and stability. It undoubtedly goes to the legs, carries sensation. This nerve is called the sciatica nerve. It comes from the spine, which is an essential part of the human body and provides support and is crucial for movement. It affects the spine in a variety of different ways. In the spine, there is a muscle nerve located in the center of the spine. It acts as the suspension of the spine. This is a spinal disc. It is used for twisting, bending, or running, such as in various applications. Jumping safely from above will not damage the bones. It is used as a suspension. Sometimes the vehicle's suspension may get damaged. A noise occurs when the vehicle goes down the slope. A tapping sound is heard. There is a noise. A small sound is produced. There is a pain in this sound. There are nerves surrounding it. Pain occurs. Sometimes if it gets damaged suddenly, it can be severe. Severe back pain causes a pain that feels like stabbing. The sciatica nerve is frequently compressed and causes discomfort. Pressure is applied. It feels like a shooting pain. It feels like being shocked when touched with a finger. This is a shooting pain. This is an excruciating shooting pain. This is a shock-like sensation. This extends from the hip to down to the leg. It is like a lightning. This painful sensation is referred to as sciatica. What exactly is the complication of this sciatica nerve? Sometimes there is shooting pain in the leg. Sometimes the legs stumble. The leg nerves get pulled and cramp while sleeping at night. Numbness or tingling in the legs. When you sit down and get up, something is affecting you. It pulls from behind. It feels like being pulled tightly. Your legs are experiencing nerve tension. Muscle nerve spasms in your legs while sleeping. Occurs, it feels like your legs are numb when you walk. Is for many individuals, when they often walk with their shoes, the outer part of the legs is slightly numb. Sometimes when they walk a lot, many people feel that it feels numb in that area. The index finger and middle fingers are squeezed by the shoes. Cannot be caught. You can feel your shoes being taken off slightly while you walk. Unable to feel. When this problem intensifies, it becomes cauda equina. It is referred to as a syndrome. Such major problems often sometimes arise. If you do not take care of it properly, you will experience. If you do not receive medical advice, the problems that arise can turn into cauda equina syndrome. Unable to walk while walking. When you urinate, there will be movement and you will lose control. This is very dangerous. This is a video about places you should not go. You are a patient with sciatica symptoms. If so, immediate orthopedic surgery is required. Consult specialists. They will examine you. The nerve is tested using the SLR test. Nerve neurology examination. The main function of the nerves is to transmit sensations and slightly activates the muscles. It is the sensory and motor part. Both these are being studied from a neurological view to determine which nerve is affected. The test helps. L4, L5, L5S1 and L3 complications are currently being determined. X-rays and MRIs are very important for determining these. In some instances, displacement occurs in the spine. As a result, the spine is damaged. This is called spondylolisthesis, sometimes called joint arthritis. Is called in the area where the nerve is located at the back of the spine. There is a joint. This is called facet joint arthritis. Your spine bends like a bow when you lean. You are holding on. This is called facet joint arthritis. This is facet joint arthritis caused by aging or injury. This includes spondylolisthesis, facet joint arthritis, and ligament tear. It is caused by the above. These 3 are very important causes of sciatica. The orthopedic doctor will examine it. X-rays and MRI to determine the condition of the sciatica nerve are being done. As we mentioned earlier, spine disc displacement. There are 4 types of causes. Disc bulge, disc prolapse, disc extrusion, and disc sequestration. Joint dislocation, joint sprain, or related conditions. Moving the joints such as the shoulder, elbow, or knee outside independently and with care. Those with a disc bulge and disc prolapse, simply do not worry. This is stage 1 and stage 2. Doing any exercise, a simple diet, taking the right medications and adequate resting. If taken, it will heal. Some have recovered within approximately 1 to 6 months. You need to do the right pain relief exercises that are specifically and carefully designed and tailored for your condition. If you definitely have a disc bulge or prolapse, you should not worry. No treatment is necessary. You can shine in simple ways. 3rd degree extrusion. This is the main cause of sciatica. If this problem is cured, the sciatica nerve will be healed. The extraction will be very painful. Initially, if you take the right medications, such as aspirin or ibuprofen. You will recover. Medication, therapy, physiotherapy, such as, in some cases, it may not heal. I cannot sleep at night. I have a lot of swelling. There is excessive numbness in the legs. I took medicine for a month. There is no progress. I took medicine for a few days. When you have a mental state like this, according to the analysis, you are undergoing micro-lumbar discectomy. You are having microdiscectomy. To be done, this is a type of surgical procedure that bone extrusion carefully removed. If the compression on that nerve is relieved, such as through appropriate medical intervention, it can completely heal and recover fully. You are healing immediately. We can walk tomorrow. We can do walking exercises tomorrow. You will not feel any pain. Micro-lumbar discectomy surgery. This is for those who cannot be cured through medical practice. Only then is it needed. In the 4th stage, it is very severe. This problem is a serious issue. A 1-month treatment alone will not be sufficient. They will experience severe pain. They cannot sleep. They think they need to be free from pain. They are performing minimally invasive surgery. In a couple of days, they can return to their normal life. They will return to their normal life in 1 to 2 months, but that important life is in danger from pain. They can recover the very next day. They can recover from that pain. Therefore, you should consult a doctor and get an MRI. Need and seek medical assistance. Later, the sciatica pain will be completely relieved. This is called post-spondylosis. There are levels 1, 2, 3, and 4. Grade 1, 2, 3, and 4. There will be no problems with the first 2 classes. Level 3, you can manage medically. In 4, you can manage surgical treatment. To reduce nerve compression, movement must be adjusted. Level 4 is very painful. The spine is slightly curved. Nerve compression is very severe. As a result, the spine appears curved. This can be easily fixed. Fearful of nerve damage, you are carefully and thoroughly considering all potential risks, benefits, and implications associated with the surgery. Should not be avoided. In today's technological knowledge, no matter how bad the situation is, if you are unable to walk, in today's medical science, returning to a normal state, very easy. So don't worry a bit. Seek medical treatment as much as possible. If necessary, undergo surgery. Right here in this video, very, very important matter. How to prevent sciatica. If you do everything correctly, proper exercise leads to proper body weight. No nerve problems will occur. Consult a doctor properly for joint problems. Undergo an MRI scan and follow the medical procedures for it, such as preparation steps. If proper treatment is not taken, it can certainly become severe. Getting rid of it is certainly indeed not quite an easy task. In fact, it is a bit challenging. If you follow the right, balanced, and healthy diet taken, it will heal. If you have any questions, concerns, uncertainties, or inquiries about the sciatica nerve, contact me. Thank you.
We have been providing high-quality treatment by accurately diagnosing the nature of diseases with state-of-the-art, world-class easy surgical equipment. We offer 24-hour accident and fracture treatments, plastic surgeries, and have performed over 10,000 knee and hip joint replacement surgeries in the past 15 years, achieving remarkable success in resolving patients' issues. As a single doctor, Bala Bone Fracture Hospital is the only hospital that has integrated any technological advancements in computers, navigation, and robotics into joint treatments, alleviating people's pain and turning it into achievements. Bala Bone Fracture Hospital, minimally invasive treatments for shoulder, knee, and foot conditions have successfully alleviated the pain of nearly 3,000 patients over the past 16 years. The staff at Bala Bone Fracture Hospital will work diligently, compassionately, and skillfully with you from the moment your illness and pain are identified until you achieve complete recovery. We consider your pain relief and the happiness it brings to your mind and body as a success of our dedicated efforts. Everyone deserves to receive everything. Everyone should live a life without obstacles. And for you, Bala Bone Fracture Hospital, Tirupur.